Good evening. Welcome to Left, Right and Centre. I'm Vishnu Shobh. On the program tonight, there's a new health minister, a new Minister of State for Health, at a time when vaccination is not where it needs to be, and social distancing, well, what's that? On the show tonight, India's most prominent expert on vaccination, Dr. NK Arora, head of the COVID-19 working group of NTAGI, or India's National Technical Advisory Group on Immunisation. He is India's leading expert on where we stand with immunizations. Getting a jab saves lives, and his job is to ensure that as many people are vaccinated as soon as possible. Next on the show, fuel prices are hiked again. Petrol at 100 rupees 56 paise per litre in Delhi, diesel at 89.62. Without major tax concessions from the centre and certainly from states as well, the common person continues to suffer. Will there be any resolution? But first, our top story. The big worry as far as COVID is concerned is how soon will there be a third wave? Will there be a third wave? And the signs, unfortunately, are not looking very promising. There was a small bump today in active cases, which is a cause of concern. Now, India's active caseload currently is at 4,60,704. India reported a net increase in active cases for the first time since May 13th. Now, you can say, look, it's just one day. And absolutely, we are all on the same side, and we all hope that that bump was nothing more than a bump. But many states are now reporting a rise in inactive cases. And the rise in active cases in India for the first time in 56 days is significant. On the 6th of July, 5 states and union territories reported a rise in active cases. On the 7th, 8 states and UTs reported a rise in active cases. On the 8th of July, 11 states and union territories reported a rise in active cases. So what is this all a part of? We also want to take a look now at this graphic on India's vaccination equation. Remember, the target has always been to vaccinate all of India's adults by the end of the year. That depends a lot on vaccine supply. Now, we've brought this down to a target of 60% of the population with both doses by the end of December 2021. Remember, Dr. Fauci in the United States said that that target should be 80%, but we brought that down. Now, in the last 7 days, the actual number of vaccinations was 4 million vaccinations a day. What should the target be to achieve that 60%, which I mentioned? It should be 8.7. Look at the top right part of your screen. It needs to be 8.7 million doses, jabs a day. In other words, in the last 7 days, the shortfall was 4.7 million jabs a day. The actual vaccination today, all right, I told you about the last 7 days, today was 3.4 million jabs. That shortfall was 5.3, right? So that minimum is 8.7 million a day. We are, as of today, 3.4 million jabs short of that. That's not good news at all. We need to speed that up. Well, joining us now, Dr. NK Arora. Thanks so very much for being with us. So, as usual, we've got a lot of questions from our viewers, a lot of questions which we've thought up as well. So, my first question to you, Dr. Arora, is this: why has Delhi run out of its vaccine stocks at government dispensaries since yesterday?
Well, this is a very micro kind of question. I would not be able to answer it, but overall, for the month of July, the government system is expected to have 12 crore doses with them. And what we are given to understand that the amount available for each state would be is already made known to the states, and then they can decide on the site and the immunization center. But on a particular day, what is happening, my apologies, I cannot answer that question because that's very operational issue. But overall, we are aware that 12 crore doses have been promised for this month. So by 30th June, we had completed about 33 crores.
Yes.
So by end of July, we are expecting that 45 crore doses should have been administered by that time.
So with this rate of vaccinations, is it inevitable that there will be a third wave?
So there are two things. One is third wave is driven by a variant. And second is the issue of immunization, as you are rightly saying. We expect significant increase in availability of vaccine in August and September, and that will plateau out by October, in a sense that there is gradual increase in the availability of vaccine in over next 2 months. So June and July there has been increase. July, as initially we were getting around 5 to 6 crore doses a month in till about May. Now we have 10-12 crores, and next month onwards we should be nearing 18 or 16-18 crores, and from September we should be having 30 crore plus doses. Now,
Dr. Arora, why has...
Let me complete.
Go ahead. Yeah.
Now, the other thing is, you just showed us that today, or yes, on 737 lakh doses were administered. So while we are looking at the total administered, if you look at the number of vaccination centers, they are also less.
Yes.
You would remember, yeah. So they are also in 30,000. There will be around 34, 35,000 yesterday, and average is about 120 doses per site. The capacity for the country, so it is as the vaccine is being given. If you also remember, in April, March, April, and most of the May, the number of centers were much higher, and the doses administered were just 30 to 40% of this 100%. So our capacity is to have at least 75 to 100,000 immunization centers across the country in government sector. Plus private, you must be looking at around 1,500.
Right.
So the whole issue is that this month you are finding that the saturation factor for immunization centers is higher as compared to April, May. June also, 15 June onwards, the saturation factor per center.
So the bottom line, Dr. Arora, what you're saying is that not just vaccines, we need more immunization centers at the government level.
Yes, immunization centers are equally important, and they are set up according to availability of vaccine. And the whole effort is that we should not waste important human resource, and every center, whenever it is opened up, 100 to 120 doses are given.
And that's the responsibility of the states. And you're saying that's the responsibility of the states, right?
Yes, that's the responsibility of the state, and simultaneously, I would also share two other things. Last week till, I think, yeah, up to 5th or so, or 6th July, polio week was going on, and polio doses have to be given. That was a national immunization day for 1 week, and about 17 crore doses were administered, so manpower requirement. So you see there is a dip. The second thing is, simultaneously now a more strategic and a smart approach is being taken, that whatever availability of vaccine is there, have similar number of vaccine centers so that they are fully saturated, and simultaneously I put the routine immunization also on track, because that has been adversely affected.
Doctor, I just want to go through more questions. Why has the center reduced estimates of vaccine availability till December? There was an aspirational number, right? But we needed that number, because if you reduce the numbers, then would you be able to vaccinate all adults by the end of December with the reduced numbers?
Yeah, so I will give you the figures. So by the end of July, we should be around 45 to anywhere between 45 to 50 crores. Let's say 45 crores. We have another 135 crores for rest of the 5 months. Right. 135 crore doses. If you add these two, this becomes 180 crores.
And that is the target. Is 180 crores is the target, right? To vaccinate all adults by the end of December, approximately.
Yes. So 180 crores will translate into, if every dose is 2 doses, there might be some single dose vaccine, but forget about that. So it is 180 crore doses, and our population is around 92 crores or so. So we should be able to cover all the adults above the age of 18 years by the end of December.
So that's a very important statement. You may not have had the vaccines availability thus far, but you're still counting on vaccines being available in a few months from now, and it'll have the situation under control. That's really important. Thanks for clarifying that.
And Tom, I will also add that the way our system is geared now, which is showing very clearly, initially people thought that it may not be possible, that each center can immunize 100 to 125. So if I have 100,000, 1 crore to 1 crore 20 lakhs, and I am sure you will be not surprised when, as the vaccine availability keeps on increasing, we should be able to achieve that.
Okay, so implementation and administration rather, that's so important. Okay, that's okay, we keep that in mind. So are you confident if we've got the ability to give the jab across states, the government and our suppliers will give the vaccines, and that we will have approximately 100% of our target vaccinated by the end of December? You are confident, sir?
Yes, so that is what we are, and the most important, so we have the vaccine available. See, I must tell you, in January, I do not know, I have spoken to you around that time, we said we have a commitment of about 50 crore doses. And the time when we started till July end, we had 50 crores, and this was the reason why, because all people above the age of 45 are about 30 crores. So we thought that most 80-90% coverage will be there. So we had a commitment of 50 crores.
Okay.
But there can be, again, it's a 10%. As I'm saying, 45 crores, certainly we will be able to do this by the end of this.
So what were...
And now what we are talking about is not assumption. 135 crore is not assumption, it is actual, and we should be having that much vaccine.
Excellent, sir. That's great to know. Now, what were the estimates of Covaxin availability by July end, and what is the reality? Is this initial problem, right? I mean, I'm talking about now, associated with the inability to ramp up Covaxin production?
So, Covaxin and Covishield, you're right. These are two most important suppliers for us. One. Number two, Covishield has ramped up. The Covaxin have started 2 additional plants. One in Bangalore, the other is in Gujarat. Initially, it was making rabies vaccine. Now they have stopped rabies and they have gone in for Covaxin production there. These 2 plants. Plus, there is this additional 3 public sector undertakings, Indian Immunologicals, Hofkin and Bibcol.
Right.
Now, these are, I think, our investment for future. So we will not count what comes out of that. It will be there, at least a couple of million doses, or I'm sorry, not couple of, couple of crores of doses will be available. But the most important is Covaxin. And Covaxin production today is, as I understand, is about 5 crore doses a month, and it should get ramped up to 1.2 billion by September. That means...
So that is the bottom line as far as reaching the target. I mean, we'll have newer producers. So, quick question, sir, because I need to move on. Zydus Cadila authorization, when will you give a yes or no? Covovax, when will you give a yes or no?
Covax?
Covovax, the Serum Institute, Novavax, it's called Covovax in India.
Acha, Covax. Covax, I'm not exactly sure the current status. As soon as phase 3 is over, I'm sure it will be able to go ahead, because they don't have to do anything much about it. The second, as far as Zydus, it's just a matter of 1 or 2 weeks. They have already submitted, and I think we should be ready to hear some good news in the coming days and weeks.
BioE?
BioE has to submit. They are still in their phase 3, and I'm given to understand that by the end of September or October, the vaccine would be available to us.
Sputnik Light?
Now you must understand the difference between Sputnik Light and Sputnik V.
So it's the first dose of the 2 doses. There's no difference in it, sir.
Excellent. So Sputnik Light versus Sputnik Main, there is no difference.
So why don't you clear it right away then?
Yes.
If the safety and efficacy is proven, the safety will have been proven.
There is a lot of discussion going on. Maybe in 2 weeks' time or 3 weeks' time, I can come back again in terms of trying. They have to share the data, and as soon as the data is shared with us, I think we will move forward. They will be sharing the data with the DCGI about Sputnik Light. Sputnik, we are aware of that.
Right.
And the regulator has given them. And in fact, Sputnik 5, they are in the process of getting emergency use from WHO also. But 5 is, Sputnik Light is something we would like to look at it very critically and then only allow it.
Last question, sir. I have only 30 seconds left with you, sir. Children, where are you with Covaxin and other trials?
Covaxin phase 3 has started. By the end of September, I think we should be there.
So you will be there, as in you will be in a position to start administering the vaccine?
The third quarter, I think sometime in third quarter or early January, February, we should be ready that our children 2 to 18 years should be getting. But prior to that, the Cadila Zydus 12 to 18 years, that data will be available by the end of next month or early September, and that we would certainly will be able to give it, because the issue of school opening and other things are very important issues, and that are being discussed very actively.
All right, sir. Thank you very much for sharing all of those details with us. We're going to quickly move on now to our next topic. Petrol prices, 106 rupees a litre in Mumbai, Jaipur and Bhopal. Petrol above 100 rupees a litre in Delhi, Kolkata, Bengaluru, Hyderabad and Chennai. Diesel above 95 a litre in Mumbai, Jaipur, Hyderabad. Diesel above 90 a litre in Kolkata, Bengaluru and Chennai. CNG prices are also up. This is all bad news for the consumer. What does it actually mean? Sushmita Dev, national spokesperson of the Congress, with us. PKD Nambiar, the political analyst, joins us as well. Sushmita, the problem, let me come to Mr. Nambiar first, in fact. Mr. Nambiar, the problem is this. Even though the price of crude oil is only 11% higher than at the beginning of 2020, the price of petrol has risen 32.9% and diesel has risen 31.5% during the same period. The problem is taxation. Shouldn't the centre be doing something about that?
Vishnu, there is no doubt that the fuel taxation is really hurting every common person. You and me are really getting the brunt of it. It's close to 65 to 70% of the tax you're paying as a tax when you are getting fueled in your car. But in the meantime, we are also in a different situation. You'll also have to look at from the point of view of an economy and government also. From the last 1 year, we were having the maximum deficit, that is 9.3% of the deficit was in the last budget. So where is the revenue comes from? People want the common poor people in this country needs to be given free ration. We need to give them a large number of fiscal stimulation in terms of supporting the businesses and etc. So the government also needs money. So it's basically a chicken and egg story. Of course, there is no doubt that anybody whomsoever comes on a television panel and say that the fuel price rise is the right thing, I will be the one. I'm the one who paid 5,000 rupees to fill my tank today. So it definitely hurts every individual. But anybody who understands a little bit of an economy today, a fuel economy, I call it, is something which really hurts. And let me tell you, this is not about just the center. Every state government, from Kerala to Rajasthan to Punjab, nobody, even in Delhi, like Arvind Kejriwal, who claims himself to be one of the biggest socialists, and somebody who tries to give everything free of cost, don't want it to leave the fuel tax. So that means every political class across the political spectrum. But you see,
the chicken and something has to be done. Sushmita, what the centre had done is that at the height of COVID, they'd raised central levies to a certain extent. They've not rolled that back. Some states have started rationalizing taxes. Do you believe the centre needs to do more?
Of course, the centre needs to do more. See, Vishnu, this is no ordinary circumstances. Please understand that the economy had already started slowing down before the pandemic. And with the coming of the pandemic and the lockdown, you have to understand that demand has totally shrunk. There's no money in the hands of the people. To put it simply, more than 1 crore people have lost their jobs. In this situation, if you're not going to give some kind of relief to the common man when it comes to price hike, whether it's of the fuel, like you said yourself at the start of the show, or any other basic commodity that one uses, whether it's LPG gas, how do you expect people to survive? He's talking about the deficit and the government needs revenue. I mean, government needs revenue. Surely you can understand, if you calculate it. I mean, I was seeing from April 2014 to June 2021, government has actually earned a revenue of 25 lakh crores from just fuel. But
No.
in these circumstances, it's not just about figures. It's just not about figures. It's not simple economics. This is about reviving the industry. It's injecting more dynamism into the demand in the economy, and the government has to be more creative. You can't just say, oh, 2 and 2 is 4. It's not one of those situations.
Mr. Nambia, there's a cascading effect over here. If the centre doesn't fix, the excise duty hike which had taken place last year, 13 rupees per litre on diesel, 16 rupees per litre, on petrol, right? Or rather 13 on petrol, 16 on diesel. This was done to shore up revenues. They've not cut that down at all. And yet we want green shoots in our economy. How will that happen?
Vishnu, that's precisely I said, that there is definitely a need of looking at how this fuel economy can be one of the major source of a revenue by any government. So it's not about just the central government, as I said. Please understand, like Rajasthan, which is taxed the maximum in the fuel, and nobody wanted to cut down. No chief minister in this country wanted to. I am saying that why the GST Council, why they are not ready to take the decision that, okay, let's put this into the highest GST tax rate of 28%. Tell me one opposition party, whether it is a Congress or any of the other regional party leaders, chief ministers or finance ministers say that, yes, we wanted to have abolish this excise duty on fuel, put this into GST. Nobody is ready. So that means it is not, it's maybe for Sushmita.
So it's not just the centre, you're saying it's the states also. Sushmita, there's a valid point over there, and Rajasthan has some of the highest fuel prices in the country. Now for several months we've seen stratospheric highs there. That being the case, isn't it a problem of all governments? It's not a Congress versus BJP issue per se. Okay, I'm sorry, I think we've lost that line with Sushmita, but I think because I need to wrap this up, I'll wrap it up with this one.
Have 1 second?
I'll wrap this up with this one point, and it reflects Delhi. This is actually from the Indian Express. Central levies account for 70.9% of total taxes on diesel, 59.1% of total taxes on diesel in the national capital. That is just absolutely incredible. I'll leave it over there. I'm sorry, Mr. Nambia, out of time. And Sushmita, I apologize. I need to leave it there, but it's certainly something I suspect we'll keep following. Need to take a short break. Sanket Upadhyay comes up next with Trending States.